Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Esteban Gentle. He's analyst at Hendry Regional Medical Center. Welcome, Esteban.
Welcome. Thank you.
Yeah, it's good to have you here. Excited to dive into a number of things you're working on with ECW, with Sunoh, a number of their products. But before we go there, tell us a little bit about yourself and Hendry Regional Medical Center.
Yeah, so Hendry Regional Medical Center is located in Clewiston, Florida. They are a multi-specialty clinic. They have orthopedics, they have cardiology, they have they even have a hospital, they have pediatrics, they have primary care. They have a bunch of specialties, and they are looking to serve the community, establish good patient care, get their quality scores up. You know, providers are cost conscious. Great hospital.
That's awesome. So tell me, what's been your experience with clinical quality measures?
So clinical quality measures, I also work with a variety of other practices. Clinical quality measures, it has a lot of layers. There's a lot of functionalities. There's a lot of items that need to connect together to make it work well, along with the payers. So first, let's describe two eClinicalWorks modules that help you to gauge how you are with your quality, and then how you can run reports, and what's the difference between one and the other. So the first one you have is Healow Insights. Healow Insights is payer specific. In other words, every payer doesn't participate with Healow Insights. So if you're trying to establish your quality, if you're trying to gauge your quality metrics for a payer that is not participating in the Healow Insights program, then that module won't work for you. Also, Healow Insights, it will send data directly to those payers that you are participating with. So for example, let's use United Healthcare. You have United Healthcare, you have Humana, you have Centene, WellCare. You have a variety but limited amount of payers that will accept Healow Insights. But the beauty of Healow Insights is that it sends the medical information directly to the payer. You don't need category 2 codes. You don't have to worry about it getting rejected at the billing level or anything like that. If the provider does a lab and the results are put in for the lab, then Healow Insights module will send those lab results directly to the payer. There's nothing that has to be done by the provider or by an EHR administrator or anything like that. In other words, it's like an interface that feeds the payers directly. So this is Healow Insights. Now, the pros of that, it sends all of the information directly to the payer, so you don't have to do anything. The cons of that is that it is limited payers. So if you have several payers that don't participate with that, that's not going to work with you. Then there is the HEDIS module. I believe they call it the bundle 3-pack.
Okay.
The HEDIS module, in my opinion, is very robust in its functionality. Here's what the HEDIS module does. Let's talk about first some of the hurdles in quality. The first hurdle that I see is there are many insurances. Each insurance has their own portal. Each insurance, you meet with them and they have their own reports. And so if you're going to work with United Healthcare and you're going to work with a WellCare, you may have another insurance that you're going to work with and try to establish your quality scores. It can be exhausting and extremely costly from a staff perspective if you have to try to go and do your measures through everybody's portal. The HEDIS module allows you to do quality as an organization, not as an insurance. So for example, let's take colorectal cancer screening, which is a HEDIS measure. Instead of trying to increase your scores for United Healthcare or any other ones, you attempt to increase your score as an organization. And if you do it like that, it's way more streamlined and you will automatically increase your scores for the other insurances. So the HEDIS module will give you metrics on every patient that qualifies based on the denominator. The Healow Insights will only do that for the payers that are participating in it. The HEDIS module will allow you to select a group of patients or a group of measures and then send messages to those patients, custom messages that you create in eClinical Messenger. So for example, and this is one of the favorites that I like about the HEDIS module, I can run a report for a measure. I can filter the report to say, show me every patient who has not met the colorectal cancer screening and who does not have a future appointment. I can grab those patients. Then I can send a message to all of those patients telling them to call the office and schedule an appointment, or sending them a link to open access where they can go and make the appointment for themselves. Whereas if you're doing it through someone's portal, if you're doing it through an insurance portal, you're not going to have the ability to do that. So it allows you to be very proactive in getting the patients in who have open gaps in their quality measures.
Yeah, that's awesome. I mean, it does get complicated with so many payers, and it sounds like we need more payers to get involved with Healow Insights so we can solve the problem more fully. To all the payers out there, sign up. That makes a lot of sense. How would you say Healow and eClinicalWorks have been a good partner to your organization?
Oh, it's an extremely good partner because, as I was leading to earlier, before the HEDIS module, before Healow Insights, you had to do everything individually. You had to get a report from your insurance carrier to see how you were doing. So if you have 10 insurance carriers that you're trying to do measures for, then you need to go to 10 different portals and get that information. No more. The HEDIS module or Healow Insights, you go to one place and you get your metrics for the organization, not for the insurance. I think even some organizations make this mistake because they're meeting with the insurance carriers, and each insurance carrier is going to focus on their thing only, right? And sometimes organizations get carried into that. But when I bring up the organizations, I'll let them know you want to meet quality as an organization, and the payers will fall into place.
Yeah.
And this will make it it'll make it very much easy to achieve and raise your score. So it's been a very good partner in that sense. And then the other tools in eClinicalWorks, and that's the key. Many things in eClinicalWorks work together. So if you have the HEDIS module, if you have Healow Insights, and you need to reach out to some patients, then yes, you can gather the lists and then send them a text message to say, hey, you should call the office so that you can get an appointment. If you're using open access, which I recommend, then you can give them a link and the patients can make the appointments for themselves. So it's an excellent partner. It also allows you to make a report based off demographics. You can do it off of location of the patients. So for example, let's say you narrow in on a measure, let's say BMI. You narrow in on a measure and now you want to dissect that measure so that you can begin to work with a specified group of patients to raise their scores. You can even run it by location of where they live at.
Wow.
Yeah, you can do so many things with the HEDIS module. It's an extremely robust tool to help you gain metrics and then raise your quality scores.
Yeah, and I mean, downstream, the patients are all benefiting from this as well, and I love the idea that you said everything's integrated together. You can send the text messages directly. I think integration is such a key element these days for most organizations. Well, let's shift gears a little. I'd love to hear, what prompted you to implement the AI medical scribe solution, Sunoh.ai?
Okay, so as we bring on other specialties, many of the providers explain that they are used to using a scribe. Now, a scribe, in the sense that they use it, is a literal person who comes into the room with them as they see the patient. And as they are seeing the patient, this scribe documents the encounter.
Yep.
We explain to the practices that eClinicalWorks has a tool that can actually do that. And when they tried it out, the providers loved it. It's a more personal experience because you have the iPad. You just click a button on the iPad and it starts to record, and you talk to the patient just as you normally would if you had a scribe. When I'm speaking with a lot of providers, many providers, I think this is all providers really don't like to be on the computer while they're discussing the patient, discussing the care with the patient.
And patients don't like it either.
Yeah, they really don't like that. So they don't want to be in there on the computer and everything, but they really do want to get all of the items that the patients are discussing. So Scribe, now here's the other thing Scribe does. After it gathers everything, it can generate an HPI for the provider. It can suggest diagnosis codes to the provider. It can suggest order sets. It can suggest medications. It can suggest x-rays. And if the provider agrees with what Scribe is saying, it's just one touch on the iPad and it'll pull it all in. So it saves a ton of clicks just from listening to you.
Yeah, it's amazing, right? How it brings it all together. Tell me more about how it helps to improve the focus on the patient. Sounds like they had that desire because they wanted a human scribe there. Were they able to? What else have you seen as far as the patient focus?
So in Clewiston, and this is one of my favorite features, they have a large Spanish population. And because they have such a large Spanish population, they have these giant machines. I believe they call them cows, or the machine is on a cow.
Cart on wheels.
Or something like this. It's a giant machine. And then I noticed they get it and then they drag this big machine into the office with the patient. And then there's a screen, and someone comes on the screen, and the patient talks to the someone, and then the someone talks to the doctor. The doctor talks to the someone, and the someone talks back to the patient. It's like, and it's a clunky experience for everyone.
Sure.
With Scribe, you can just tell Scribe that you want it to translate in a multitude of languages that you want to operate in, or whatever the patient speaks. And the patient can speak in their own language, and the provider can speak in his own language, typically English, and Scribe will just do everything on the iPad right there, nice and seamless. It won't make the patient nervous with this big machine talking to this strange person. So that has been a big game changer at Hendry Regional. Even the patients speak about using this compared to their previous experience, and they found it much more nicer.
And so you're saying with Sunoh, the patient could be speaking Spanish while the doctor speaks English, and the caregiver speaks English, and Sunoh can kind of translate between all of them?
Mm-hmm. Exactly.
Wow, that's incredible. I love that. And it makes it more accessible for the doctor, for the patient. What an interesting patient-focused experience. Let's also talk about some of the other business aspects of it. What's been the impact on, say, revenue, billing, since implementing Sunoh.ai?
So here is and that's the beauty in a lot of eClinicalWorks products, because sometimes I wish I could be with eClinicalWorks marketing, because sometimes I don't know if eClinicalWorks knows all of the benefits of the things that they market. So let's talk about Sunoh a little bit more. Let's first talk about something many larger practices struggle with: providers locking notes on time. When a provider doesn't lock a note on time, it affects billing, it affects coding. How? Because every day that note is unlocked, it is a chance for that to convert to a claim that's going to be denied for timely filing, right? So if the provider locked the note in time, there's a better chance that it's going to be paid timely, get the money in, close the claim out. But here's what the providers will explain. Providers will remember, a provider is trained to focus on a patient. When you go see your doctor, his main concern is you, not the progress note, not billing, not revenue, not CPT codes. His primary focus is you, and everything else is secondary. So if he has a full day of patients every day, it's possible that he won't get to lock a note for 5 days, 6 days, 7 days, 10 days straight, right? And then he also has to remember the conversations, look at his notes and everything, and put everything into the system. And that's what makes locking notes take a lot of time,
Sure.
because they have to look at some kind of apparatus to remind themselves of what was discussed during that visit. With Sunoh, when the whole thing is documented, it actually saves it. And now the provider can quickly go back and, like I said, convert that quickly to an HPI. Take some things out, put some things in, push in the diagnosis. It gives the medications and everything that's suggestive. And that enables him or her to document more seamless and way quicker than they would with their paper apparatus, because that's the thing that I see the most. So in that aspect, they lock the notes faster and it goes through the billing process faster, avoiding temporary denials due to timely filing. In some places, including Hendry, they have coders.
Mm-hmm.
Now, what separates a coder from a biller is a coder is mostly operating from a progress note.
Mm-hmm.
A coder can code to the highest level of specificity based off what the provider documents. And then there are other elements to coding. Did he review a lab?
Sure.
Did he go over a medication? There are other elements. And the more the coder can gauge from that encounter, the better the coder can select the CPTs and ICDs. And the better the coder can select the CPTs and ICDs, that's an increase in revenue. Okay? So imagine this. The coder can now be in the room with the provider, because now that coder can also access that transcribed document. So providers are not coders. They may discuss things with the patient that are billable or would at least lift their code up, but they might not put it on the progress note because they don't think it's significant.
Yeah, or they don't have time.
I think they would put it if they knew, right? But they don't put it because they don't think it's significant. The coder doesn't see it, so he or she don't know to ask for it, and it gets missed. But now with Sunoh, the coder, you never would think of coder in Sunoh, right? You think of it and you just think of providers, Scribe, and talk. So many benefits. So now the coder also has access as if he or she was in that encounter. Now they can see they discussed the lab, they discussed the previous history, they discussed some results from another provider, and they can raise the level. And if they can raise the level, that generates more revenue for the practice. Whereas if that coder did not see that full patient encounter, or they would not even know to ask the provider to please document this because they saw it in the encounter.
Sure.
So it benefits coding in that way, and it benefits billing in that way, because one, the provider is locking it in a more timely fashion, and then for two, for those practices that have coders can look at the encounter basically in real time and ensure that everything that can be extracted is extracted, and then they can select the CPTs and ICDs appropriately, raising the chance that you increase your revenue.
Yeah, what a beautiful description of how, it's interesting. The power of capturing everything that happens in the visit in near real time is creating a phenomenal opportunity. So what would you say you're working on next? You've done Sunoh, we talked about quality measures. What's next on your list? So
eClinicalWorks is coming out with a product called Healow Genie, and I think this is going to revolutionize the medical industry, because I have yet to encounter a practice that doesn't struggle with high patient call volume. And there is only one way to deal with patients calling. You need a physical person. A physical person has to be available to pick up that phone. I mean, some practices have call centers. They have a group of people, and they just answer the phone all day because they have that much volume.
Yep.
And they have this many calls. And right now there's no solution. What do you replace a a patient calling in with? Well, they're coming out with Healow Genie, and it's a beautiful product. Healow Genie has the ability through AI to identify a patient's question and then answer it from the progress note. When I ask providers, and I actually did a test once, and I'll tell you about that in a minute. When I ask providers and when I ask staff and when I ask organizations, what's the primary reason you get calls, continue for calls? Do you know what it is? Patients are calling to know when their next appointment is.
Simple stuff.
They got patient portal.
Yeah.
They got so many tools.
Reminders.
But some people, we still got some people from the older generation, even such as myself. They don't want to click and log in and password and all of that. They just really used to just picking up a phone. That's what they know how to do, asking a question and getting an answer. So Healow Genie will allow that patient to call and say, hey, when is my next appointment? The Genie will ask your date of birth, some identifiers, and then after identifying the patient, be able to tell the patient their appointment. Now that patient doesn't have to call the office. But let's say in some situations, a patient does actually have to speak to a physical person. Genie will have enough understanding to transfer them to a physical person. But I mean, like, they can call and get lab results, just a myriad of things that they would normally have to speak to a person for.
Mm-hmm.
It could even make an appointment.
Right.
So all of these things that you have to have a physical person for, Genie is going to be able to handle that. So definitely we're going to roll that out, because I believe that it will slice things in half. It will slice patient call volume in half.
The area I love it most is every organization gets spikes in calls Monday morning, right?
Yes.
You get that spike in call. And so you don't want to staff up for the spike in calls, because then the rest of the day you don't need it. But guess what? With an AI bot, it doesn't matter.
Now, I'm so glad you mentioned the spike. Why do you get the spike on Monday? I'll tell you why. You get the spike on Monday because I'm not going to call the practice at 7 o'clock asking for my appointment, because I know everybody leaves at 5. I have to wait till Monday. And everybody like me that like to pick up the phone and say, hey, when's my next appointment and what time and all that, they also have to do the same thing. So they all got to wait till Monday. But now at 8 o'clock p.m., when I realize, I don't know when my appointment is, I understand now that Hendry Regional has Genie, and I can call and the Genie will tell my appointment. I don't have to wait till Monday. I believe it will even drop spikes like that down.
That's interesting.
Yeah.
No, that's a really good point. And let's be honest, most of us want to call it 8 p.m., 9 p.m., 10 p.m.
Yeah,
because that's when we get off work and we have time to actually
address your car it. On your phone, which you shouldn't be, but yes.
Absolutely. Well, I love that. Esteban, this is really interesting. I love your description of how you're leveraging so many different products. Sunoh, leveraging insights, and Genie as it comes. I think all of these are great examples of focusing on the patient and providing awesome care for them, but also making sure that the business is effective. So I appreciate you so much for sitting down with us and talking with us. And thanks everyone for watching and listening.
Take it easy,
if you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com and search for Healthcare IT Today on your favorite podcasting application. Thanks, Esteban.
All right. Thank you, Don.